Adolescence, the period of transition from childhood to adulthood, is a crucial stage in the life cycle of every human being. Available evidence suggests that adolescence is a time when the attitudes, values, and behaviors that will determine a person's future begin to take shape. This process is marked by exposure and experimentation.
And because of this, psychologists feel that most problems in the system emanate from adolescence, and that if problems of adolescence are solved, then half of the problem would have been solved.
In recognizing this fact, the Ghana National Population Council came out with an adolescent reproductive health policy, which emanates from the General Reproductive Health Policy of the Ministry of Health in the year 2000.
The policy was developed so that all other players, we are not implemented by coordinators of some of these implementing processes. And we think that once the document is there, it will be something like a blueprint for carrying our programs on the adolescent.
Although adolescent sexual and reproductive health has become an issue of concern to governments, demographers, and planners all over the world, the needs of the young people who form majority of the world population remain poorly understood or served. According to national statistics, in Ghana, over 50% of the total population is under 19 years. Therefore, the youth is a major human resource base the nation cannot do without. The neglect of this population, especially their sexual reproductive health, has major implications which, if not addressed, will impact negatively on Ghana's vision of attaining a middle-income status by the year 2020. However, solving this challenge must not be left in the hands of government alone. It requires the collaborative efforts of all stakeholders. It is against this background that Association of Church-Based Development Non-Governmental Organizations, ACDEP, with support from Catholic Organization for Relief and Development Aid, CORDAID of the Netherlands, is implementing a project which seeks to integrate adolescent reproductive health activities into existing primary health care programs of its health sector members.
We did a survey in 2004 as part of a larger program we implemented. And we realized that one, the adolescents were not reached. Two, in spite of the creation of the adolescent health corners, the adolescents were not participating because there were certain stigmas around seeing young boys and girls going to those corners. And then we also realized that issues of teenage pregnancy were increasing in most of the areas that we were. So we realized that then there must be something wrong. And that something wrong is that we must be able to find mechanisms of reaching the adolescents where they are without creating the stigmas that are associated with them going to the clinics. The basic objective of the adolescent health program is one, to find more socially and culturally acceptable ways of reaching adolescents with reproductive health service, whether it is in terms of access to contraceptives, education, or whatever, and to do it in such a way that they are able to participate. So that's one of the things that we are doing, and then bring this experience of a better way of reaching adolescents with reproductive health service. Bring that experience to the Ministry of Health and the Ghana Health Service, so they can begin to now see how we're going to adapt adolescent health services for the youth in such a way that it reaches them. So that is the basic objective of the program.
At the initial stages of the project, one observation we made was that the health facilities at the community levels were not adolescent friendly. The staff themselves were not adolescent friendly, and the manner in which some of the services were rendered were not adolescent friendly. So we needed to build the capacity of the staff to bridge that gap.
We actually had problems here of teenage pregnancies, abortions, school dropouts. We held meetings with opinion leaders, teachers, assemblymen, the chiefs, and then the church elders to see what can we do to stop all those things. And then we also started in our own small way, because we didn't have the skills. Actually, it didn't end up well. And then we're lucky ACDEP came in, and that they helped us to train peer educators and then some teachers in some schools, and then they also train the health staffs.
72 adolescent clubs have been established within schools, churches, mosques, and communities, with a total number of 2,884 members in 7 districts in the northern sector of the country. The districts are East Mamposi and West Mamposi of the northern region, and Boko Municipal, Bongo, Busa, Garu Timpani, and Talansi Nabdam in the Upper East region.
We meet on every Wednesdays, and what we do is we do the peer education. We have our adolescent corner, and what we do in these corners are we teach them the prevention of STDs and HIV/AIDS. We teach them how to prevent teenage pregnancies, how to stand firm on their answers, or how to relate to the opposite sex. We also teach them, in case you are not able to abstain from sex and you become pregnant, you come back to us and we will deal with you accordingly. And we also let them understand that if you were already misbehaving with guys, meaning you didn't know, so now that you have met the peer educators group, you'll be able to behave very well in the society.
These clubs have 2 trained peer educators each, who lead their individual group discussions on the various sexual and reproductive health and life skill topics. The adolescents also engage in sensitization and education of their communities through drama, role plays, and songs.
We are in Jawani, a community in the East Mamposi district. Jawani is one of the 18 communities within which BMC Public Health implements the Adolescent Reproductive Health Program. Some of the things we take the adolescents through during their discussions are adolescent development, unsafe abortion, effects of unsafe abortion and teenage pregnancy, assertiveness, decision making, community mobilization, and other topics. Drama is one of the major tools or major strategies we use in passing on the information to the adolescents, and the adolescents themselves passing on the information to other community members. So we are here today in Jawane to witness a drama by the club, the Adolescent Reproductive Health Club in the community.
They had a drama on teenage pregnancy, and the drama was all about how 2 families had their children, both girls, like the 2 sets of families had girls. And what happened was that one set had a good family, like the children were encouraged to go to school and complete school. The other family did not. I mean, even though the father wanted to the girls to go to school, but the mother wanted the girls to be like selling or be doing other things to bring income to the house. So at the end of it all, what happened was one of them got pregnant from the family that did not attend school. So eventually one of the girls got pregnant and had all the complications of teenage pregnancy. That is, she caused an abortion, started bleeding, and when she finally was taken to the hospital, it happened that she had to lose her uterus. And so she couldn't, they told her that at the end of it all, she couldn't get a baby. After the drama, I took the community members through, I asked them what they learned from the drama, and then some of the women and even one man interacted. One said it was really something they've learned, that the children were learning something from the adolescent health clubs. That is, they know about teenage pregnancy. They themselves also know about teenage pregnancy from the drama, and that they will encourage their children to go to school. They will encourage their children to be able to follow the steps until they complete schooling and not to get pregnant. Another lady talked about the effects of abortions. And then another man also reacted that when the girl who wasn't schooling got pregnant, she didn't even know who the boy was. So eventually he advised that they should try, even if they are going to get married, involve the family. So these are some of the things we do within the community, like dramas, so that the community members can learn something from it.